These things control the arms, right, so that they can move around.
The slightest movements of Dr. Michelle Toder's hands while looking into a video game-like console is controlling the instruments used to perform surgery.
So you can see nerves and blood vessels more easily than you can see with standard laparoscopy or even an open procedure. It gives you less trauma to the tissue because you now have hands in there that can bend around structures that are pretty much round in your belly.
Dr. Toder has performed a little over 1,700 of EMMC's robotic surgery procedures.
We're a little faster, we use a few less instruments, length of stay is a little shorter, pain's a little less, nausea's a little less.
But Dr. Paul Danielson, the chief of division of pediatric surgery at All Children's Hospital of Johns Hopkins Medicine, says there are limitations.
Robotic technology has not evolved haptic feedback yet. And so when I'm using a robot and I'm squeezing using the controls, I don't get any feedback into my fingertips of exactly how much pressure I'm exerting on the tissues inside the body.
Another obstacle is what a patient thinks. When we hear the word robot, we think computer. When we think computer, some might think computer crash.
Robots that are pre-programmed, and they've seen those pre-programs malfunction, and so they just want to know their insides aren't going to be like turned to sushi by a robot gone wild.
Dr. Toder says the entire time she's in control, her head is in the console looking at the high-definition magnified view, and the robot mimics her actions. Once she takes her head out of the area view, the robot won't move. She says robots eliminates even the slightest shaking a doctor might have while operating.
I do believe that over the next decade or two, as the technology evolves, that more and more procedures will be done robotically. At present, however, there's only a few procedures that have been shown to be done as effectively or better with a robot than with traditional techniques.
But for now, Dr. Danielson believes we are a long way from getting equipment that can outdo a surgeon's hands operating on you.
Robot's very best feature is its ability to sew like you had hands in the patient. You could sew front hand, back hand, upside down, left hand, right hand. It's amazing.
Dr. Toder recognizes the limitations but believes this is the future and can envision the changes coming.
We're hoping, I'd love to see her have arms that are more like endoscopes, you know, that can bend any old way, or maybe arms that came off the table, so if you wanted to tip the patient, the robot would go with it.
In Bangor, Kaitlyn Chana, News Center.